April is Autism Awareness Month, and today we will hear inspiring stories of neighbors in our community. Their stories will help us understand some of the challenges and successes families and caretakers of individuals with autism spectrum disorders experience. We are also joined by expert panelists who will discuss how they are coming together to support and assist families with autism spectrum disorders. And up first is a story about a nonprofit that has been providing guidance for families of children and youth with special needs for more than 40 years. The organization is getting ready for their 20th annual walk. The Any Baby Can Walk for Autism is happening April 20th at Palo Alto College. We caught up with one family to find out how Any Baby Can of San Antonio changed their lives.
She's so strong-willed. She's funny.
And 8-year-old Aaliyah Flores loves to explore.
She used to play by herself, but now she is wanting to engage in others.
Marlo and Johnny Flores tell us about their daughter's journey.
She did not have a lot of eye contact, not a lot of facial expressions.
Aaliyah was diagnosed with autism spectrum disorder when she was 20 months old. The Flores family is thankful for the nonprofit Any Baby Can of San Antonio that helped them navigate autism.
They immediately set me up with a case manager. The case manager came to our house. I remember her bringing this big binder, you're going to need this for life. And I mean, she was right.
The nonprofit offers a broad range of services, from case managers who help link families to local and state programs to autism services.
They gave us classes to attend, from ABA, what is ABA therapy, applied behavioral analysis therapy, to potty training strategies.
They welcome you with arms open.
Every year, the Flores family comes together in April for Any Baby Can's Walk for Autism to give back to the organization that changed their lives.
We have shirts, we wear our tutus. Aaliyah's the star of our show.
The 20th annual Walk for Autism is taking place on April 20th at Palo Alto College. There will be resources from a variety of organizations, businesses, and service providers. Aaliyah's family is excited for the event.
It means the world to us. We have an autistic grandchild, and she has really immersed in this. It's so heartwarming to have an organization that supports them.
Aaliyah's mom has a message to her daughter.
Not to give up. She has a strong family support system. We love her, and we're just gonna keep pushing forward to be the best that she can be.
Tiffany Huertas, KSAT 12 News.
Bringing together more than 6,000 participants, the Any Baby Can Walk for Autism is an official fiesta event. All the proceeds stay in Texas and provide one-of-a-kind services that help support families raising individuals on the spectrum. The festivities begin at 8 a.m. and you can find out more about the walk on the KSAT community portion of our website. And to talk more about the walk and the organization putting it all together, we have Tyler Ferguson, interim CEO of Any Baby Can. Thank you for joining us,
Yes,
Tyler.
thank you. We're excited to be here.
Since 1982, the nonprofit has been helping families. Can you share how the organization has developed over time?
Yeah, so 41 years is a long time for a nonprofit to be helping families. We started as one nurse, Dr. Marian Sokol, who's now at the Children's Bereavement Center, just wanting to help families who were going into the hospital happy and hopeful and excited about the future, and then coming out having received a diagnosis in their child and not really knowing what to do. And so she just started providing care and support and guidance to these families. It grew and grew and grew to the point where now we have 5 programs. We're serving over 10,000 people every year, but at the core of it, we're still doing the exact same thing. We're walking with families who have children with special healthcare needs, including autism, to make sure that they're not feeling so overwhelmed by their situation and they can thrive.
Walking together is so important. Now, what types of assistance and training could families expect to receive at Any Baby Can?
So when a family comes to Any Baby Can, the first thing we're going to do is really make sure that we understand everything that they need. So we're not there to just care for one piece of their family, or we're not there to just take care of one problem. We're there to get a really holistic picture of what it is they need and walk with them every step of the way. Our Autism Services program, specifically this month, is such an important program of ours, where families who come in, some of whom don't even know what autism is, they get this diagnosis and feel like it's this big monster, this big scary thing that they don't know how to handle. We'll enroll them into classes understanding autism, toilet training, behavior, these kinds of things, to really give them a good handle on what it is that's in front of them and give them advice on how they can thrive.
Do families need a diagnosis in order to engage with the organization?
Yeah, that's a great question. So that's one of the really unique things about what we do. We recognize specifically with autism that one of the major hurdles families face is just getting a diagnosis. And so we don't require a diagnosis. A lot of times what we'll get is we'll get a phone call, and it's kind of mother's instinct, right? Mom calls in and says, there's something going on with my child. There's something that's not right. I don't know what it is, and I can't get anyone to listen to me. Will you please help? And those are some of our favorite clients to work with.
And we're going to dive deep into that a little bit later, but let's talk about this walk. A lot of preparation. The team is so excited for this. Tell us, what can people expect at this walk?
The walk is a beautiful, beautiful thing. So it's so much more than a fiesta event. It's so much more than a time for families to come and have fun and enjoy one another, enjoy other people. Of course, they're going to do that. But what we've really tried to do is we've tried to make it this really inclusive space where families, look, families who are raising kids with autism, a lot of times they go to the playground and people stare. They go to the grocery store and people ask questions. They deal with this all the time. And so the walk is a place that families can come to every year, and they can let their guard down. They can be with other families who are in a similar situation to them, and they can just have fun. Their kids can have fun in a judgment-free, inclusive space, which is what we really try to provide.
And we talked to some families that are going to be joining that walk, but let's talk about these programs also. These families are part of this community and are getting all these services. We spoke about the SAPD program.
Yes, yes. Our community training is another arm of what we do. So in addition to helping families, we want to educate the community. One of our proudest partnerships is with the San Antonio Police Department. We get the pleasure of joining with some other organizations to come in and provide training to SAPD cadets before they even hit the streets on here's what autism is, here's what it might look like if you pull someone over at a traffic stop who has autism, and here are some ways that you can interact with that person without it escalating. The cadets love it. We give them hands-on tools to help them experience what it's like to be a child with autism, so they come away really understanding how to interact with the community.
Any Baby Can started with SAPD, but are there plans to maybe expand this training?
We do so many community trainings across a whole lot of types of organizations. So we work with San Antonio Independent School District. That's one of our biggest school district partners. We provide training to parents through the school district. We also work with local businesses. One of my favorite stories is that we have a barber shop that came to us, and all they want to do is learn how to interact with kiddos and give haircuts to kiddos who have autism. So we actually brought their staff into our building and trained them on what autism is and how they can work with kids who have autism. It's a really cool thing whenever members of the community come to us like that.
Now I need to go to that barber shop and meet these people.
Absolutely.
Well, thank you so much, Tyler. And we did go behind the scenes of that cadet training course, and we want to bring you this story. Autism symptoms and behaviors present differently for each individual on the spectrum. So people with ASD may not interact and communicate in the way most people are used to seeing. Local nonprofits are working together to bring awareness to this. So they've teamed up to create this training program to help San Antonio police cadets better understand autism spectrum disorders. Let's take a look.
I would describe my son as the nicest person you've ever met in your life.
Robert Peden says his son Logan was diagnosed with autism spectrum disorder when he was 2 years old.
My son was diagnosed at 2 years old at Triple Army Medical Center in Hawaii when I was in the United States Air Force.
Peden's love for his son and passion for helping parents navigating autism spectrum disorder eventually led him here.
This is why we do this training.
He is part of this program that started last year. It teaches San Antonio police cadets how to respond to incidents involving people with autism. Peden works at Any Baby Can of San Antonio, a nonprofit that serves families with children and youth facing serious health or developmental challenges. The organization also provides autism support. Margarita Llamas is a parent educator in that department and believes this training can save lives.
We do give them some exercises or some situations that they actually learn how to feel what the children that have autism or the individuals that have autism, how they feel.
Any Baby Can of San Antonio says in Bexar and the surrounding counties, over 30,000 people are living with autism.
Be prepared to be.
Another organization involved in this course is Family Adventures. Nicole Santiago is the CEO.
One of my clients was unlawfully arrested, and I filed a complaint, and we had a meeting, and the police were open to us coming in to train.
Every cadet class is now taking these trainings.
We talk about different sensory needs, different communication needs. So for example, I have communication boards I use, so sometimes if someone becomes, with their anxiety, they become non-speaking, they can use the board to point to what they want to say.
The CDC says about 1 in 36 children has been identified with autism spectrum disorder.
Autism is a developmental disability or disorder that is diagnosed in childhood, and it affects communication chiefly. It also affects social skills, sensory processing.
The training is super helpful because it helps develop a level of competency in our new officers. These are cadets preparing to become officers serving the community, and it helps them to develop relationships and to learn how to interact with really all people from our community.
Tiffany Huertas, KSAT 12 News.
And joining us, we have Laura Loya, Director of Case Management at Any Baby Can. Thank you for coming, Laura. Fostering trust is important. So how can families and caregivers help their loved ones with autism spectrum disorder interact with the police?
I think one of the most important things, especially within our agency, also that makes us unique, is we start with understanding autism in our parenting training classes. And I think that's one of the most important things that our families can do. Another thing that makes us unique is it's not just caregiver that we're looking to educate. So if grandma wants to come, maybe she has him 50% of the time or her 50% of the time. If aunt wants to come, anyone really in the family is welcome to attend our trainings, and they can get a little bit more education on what autism is, how it affects them, because you have these stereotypes. Sometimes within a family there's a stereotype, and that's always good to break those generational stereotypes within families and get a little more education through our classes. I would recommend our classes to learn more about what it is.
Last year, Any Baby Can served almost 10,000 people. What is the process like for a family who enrolls with Any Baby Can?
So most of our potential clients or families that want to come for services, they will either call in or they'll utilize our website, which is www.anybabycansa.org, and that'll take them through the enrollment application, and then they'll get set up with our front desk person who really has a good handle on hearing what their families are needing, as well as dispersing them in a way to the category and program that fits them best. También hablamos español, so anyone who needs to come in who speaks Spanish, we also help them as well.
Se puede sentir el amor. Everyone there, you can feel the love of all the staff, and just interacting with everyone over the past month, I felt that. Now, what are some of the topics discussed in the group session, specifically the sibling support group?
So we always start with different diagnoses, trending diagnoses. So autism is one of them. We've had anything from cerebral palsy to congenital heart failure. A lot of times the siblings of our kiddos who are diagnosed, they don't understand the disorder. All they understand is mom is gone, sister or brother are in the hospital. They don't understand why they're away. So the first thing we always start with is, let's understand why your sister or brother are having to be in the hospital or having to do this. And really it's just wanting to create a safe space for them to talk about what it is that ails them, challenges. I want to know about their own successes, just a place for them to really talk about everything that they're feeling.
Have you seen how it's changed people's lives?
Absolutely. Actually, the most recent one that I'm super proud of is a military family. So they have siblings, 16 and 17. They're some of my older teenagers that come in. They are constantly moving. I mean, they're constantly getting those orders to move. They don't really have time to make friends, to keep friends, to talk. They don't really have anyone to talk to. And if mom and dad are constantly gone, maybe one's deployed, having them come here to the sibling support program and meet kids that are going through the same struggles or challenges has really been great. I've seen them come from, I don't want to be here and my hoodie's over my head, to leading the TikTok dances. I usually start with like a icebreaker, and I just love that. They've gone out of their show.
The Flores family shared about this case that is given to the families that they'll take with them forever. That's just so much information that Any Baby Can has, right?
Yes, absolutely. We give them all that information just to kind of get them set up and prepared. Some of the stuff they'll recognize, some of the stuff they won't, but we walk them through that process on what each thing looks like.
Thank you, Laura, for sharing all of this information.
Thank you.
Now, we want to hear from health professionals who also work in this space, and families across the country, they work with them. So a delay in diagnosis can hinder that opportunity for proper treatment, making life challenging for someone living with ASD. So a pediatrician shares her frustration with the delays in autism diagnosis and treatment. It's important that we do mention that the 3 years to diagnose that she mentions can vary. Some kids could be diagnosed earlier.
Even as a pediatrician, we are facing this mountain of just obstacles for these families, from just trying to get a diagnosis, which can be up to 3 years of a wait list, and then being on another wait list to get therapies.
But a virtual clinic is helping reduce wait times for autism evaluations nationwide.
As You Are is a virtual clinic that we do autism evaluations. Everything is done via telehealth, and we will assess each child from 16 months to 10 years old for signs of autism.
Pediatrician Tracy Burton is the assistant medical director at As You Are. She says early intervention is key.
So much data has come out that starting therapies early and starting any sort of early intervention really can help the child learn how to manage their symptoms and help with family life and school functioning.
The CDC says about 1 in 36 children has been identified with autism spectrum disorder. Burton shares some signs of autism.
If your child is not responding to their name, they're not making great eye contact, they haven't developed a lot of speech by a certain age, those are pretty big red flags. And other red flags are, do they have really particular sensory things? Are they picky eaters? Do they echo with what you say all the time or make certain repetitive sounds?
As You Are works closely with the nonprofit Any Baby Can of San Antonio that has an autism services program designed for families raising a child diagnosed with autism spectrum disorder.
We would tell them that Any Baby Can really could provide great services like parent training classes for to guide them through the next part of this journey.
Autism services at Any Baby Can include parent training to support groups. Burton says these are helpful for parenting resources.
Any resource that they can receive, like from Any Baby Can, is so helpful.
Burton says these are helpful parenting resources. Tiffany Huertas, KSAT 12 News.
As we've already heard, important indicators that could help with making a diagnosis would be if your child is not responding to their name, or if they are making repetitive sounds. Other red flags like sensory processing disorder or delayed speech are also important to watch for. Individuals with autism spectrum disorder communicate and interact differently. Identifying the signs and making a diagnosis can vary by person, so it's critical to know what to look for and to talk to your doctor or pediatrician. And if you take a look at your screen, you'll see a list of services offered by the nonprofit Any Baby Can. You can also call to talk to a representative to learn more. And to understand more about autism, we have Dr. Lonnie Shepard. Thank you for joining us.
Thank you for having me. I'm excited to be here.
Let's go back to that data from the CDC. About 1 in 36 children has been identified with autism spectrum disorder. How has that changed throughout the years?
So the diagnosis of autism is still relatively new, within about the last 70 to 80 years. And so with that, our understanding of that diagnosis and the prevalence has also changed. So in many years ago, 40s and 50s, the prevalence may have been anywhere from 1 in 1,000, 1 in 2,500. As recent as 2000, it was down to 1 in 150, and then in 2020, around 1 in 84. Now our prevalence is about 1 in 36, and so that prevalence has increased over time, probably due to a variety of factors.
And then when we talk about the causes of autism, are there many?
So the honest truth is we don't know exactly what causes autism. We do know that there are many factors that come into play. There are most likely genetic factors, there are environmental factors, so things that children may be exposed to in the environment, or prenatally there may be other risk factors that can kind of increase that likelihood of autism. So that's still an area where we are definitely researching a lot, because we don't have any one particular cause for autism.
And we heard in that story, I want to talk about that frustration that some families and caretakers may face when trying to get a diagnosis. So what are some of those challenges?
So one is just access to care. Many families in many areas of the United States, and especially in Texas, have difficulty just getting in to see a physician to make that diagnosis. And so those wait times can skyrocket when you're talking about trying to get a child diagnosed. It's so different compared to other diagnoses where, you know, your wait time is maybe a few weeks or a few months. But with autism, it can be upwards of 2 years to get in to see a physician to get a diagnosis. And so that's one of the areas where we're really trying to focus on decreasing those wait times and trying to get patients earlier access to care and earlier diagnosis so that they can receive services.
Is there a limited number of providers who will conduct an evaluation?
There are. So that's one of the challenges that many families face, is that there aren't enough providers that are doing autism evaluations. The company that I work for, As You Are, is focusing on trying to cut down those wait times and also providing increased access to care for families so that they can get a much earlier diagnosis and that they can do it in the comfort of their own home.
What are some of the things that parents or caregivers can do to speed up the process?
So just being persistent. As soon as you notice any differences in your child's development, or you have any questions about maybe how they're interacting with others, talking with your healthcare provider and really pushing for that referral or pushing for some in further depth evaluation. We know that a lot of times, even from the time that families first have any concerns, even if they're getting a timely diagnosis, it's still a huge wait between when you might notice some first signs from your child to even getting in to have an evaluation. And so for families, just really asking those questions, talking to your physician or your healthcare provider when you do have concerns, or if you're noticing any differences that you think, maybe I need a little bit more guidance on this.
How important is early intervention?
We know that early intervention really does help improve children's functioning overall, whether they have language delays or whether they need extra support in school. The earlier we can provide services to children, the better it is overall, so that they're able to meet their potential and really thrive in their environment.
What message do you have for people watching, maybe some family across the state or in another state? What do you tell them about your organization?
So our organization, As You Are, is extremely readily available. We're able to provide care to patients in all 50 states, and we are able to provide virtual diagnostic evaluations for children 16 months to 10 years of age. And so it's as easy as going to our website, asyouare.com, and signing up, going through a screening process, and then we can walk them through that evaluation, which takes place virtually via telehealth. After that process, we try to plug families into organizations or into care like Any Baby Can. They have such wonderful resources for families, and so after our diagnostic process, it really helps to have organizations like that where they can get that support ongoing. So even after the diagnosis, it can be incredibly isolating, and so having those organizations available for parents really helps improve their journey and their navigation through that diagnosis.
And just talking to families and pediatricians, we know clinics like yours and organizations like Any Baby Can will help them for many years to come.
Yes.
Thank you, Dr. Shepard, for joining us. Now, families across San Antonio have told us how organizations are helping them navigate autism. A San Antonio mother shares how her son inspired her to create a safety toolkit for parents with children with autism. Take a look at how the nonprofit Any Baby Can helped shine light on the importance of fire safety for people with autism.
We have the locks, which is very important so that they don't get outside of the house. There are so many instances where children, they will get out and they don't have any way to come and say like, hi, I'm so-and-so and this is where I live.
Abby Ekmark teamed up with the nonprofit Any Baby Can to create this safety toolbox kit.
This safety toolbox is for any parent or first responder that wants it for their children with special needs so that they have a way of communication.
It was put together in honor of her 6-year-old son, Rudy Alejos.
In August of 2011, I was in a fire with my son and I tried to take us both out and he died in the fire.
Rudy had autism spectrum disorder.
I have so many people over the years, it's been over 10 years now, that they come to me and they say, because of your story, I started talking to my kids about a fire plan.
Abby says the nonprofit Any Baby Can has helped in many ways, and she is now getting ready to give back by participating in the 20th annual Walk for Autism San Antonio.
For me, I think it's the aftermath. My family gets together, we go to the cemetery and we visit him, and but I feel his presence.
The walk is taking place on April 20th from 8 a.m. to 11 a.m. at Palo Alto College. There will be an area where kids can play, dedicated to Abby's son, Rudy's playground.
The Walk for Autism is coming up, and for my family, it's not just a walk, it's a day of remembrance.
Tiffany Huertas, KSAT 12 News.
And Tyler is back to talk more about the safety toolkit. You have it right here. Can you show us some of the items that we can find inside?
Yeah, so first of all, we were so inspired by Rudy's story that this safety toolkit came about, and so we've got all sorts of materials, visuals that families can use to help their child understand what am I supposed to do in the case of an emergency. For a child on the spectrum, things like sirens and lights and the commotion and all that can be sensory overload. And so the kit is full of items that families can use to help overcome that. We are so serious right now about continuing on Rudy's legacy and making sure that that his memory lives on and helps as many people as possible, that we are actually in the process of completely renovating this toolkit. We're meeting with San Antonio Fire Department next month to get their input and their ideas on what's going to go in this, as well as putting a suggestion box at our walk for members of the public to tell us what they think would be helpful in a toolkit like this. So stay tuned for an even bigger and better resource for the community.
And we know that training also came because of this at Any Baby Can. So these are just some of the locks that Abby was mentioning.
Yep.
And then over here we have like the flashlights and just different items. So now looking forward, are there any programs that you hope to also expand?
Absolutely. So our safety training, first and foremost, is probably the biggest program within our autism services program that we're looking to expand. We're just scratching the surface on that. But we know that parents who are raising kids with autism have a whole lot of questions when it comes to what do I do in the case of an emergency. So what we have now is a fantastic resource, and we welcome anyone to come. But 6 months from now, with feedback from the fire department, with feedback from the community and whatnot, the number of classes we're going to offer are going to expand. The types of classes around safety that we offer are going to expand, and the physical resources we give to families are going to expand as well.
Can businesses and community members also get involved?
Yes, absolutely. Anyone can get involved. So the way our training works is that while a lot of what we do is geared towards parents, I mentioned the barbershop last segment, any businesses like that who want to make sure that they are on the cutting edge of how to serve children with autism can come to us, can reach out to us. If we don't have a training that fits your needs, we will talk to you and we will come up with one that does.
You'll create one, which
We
I love
absolutely
that.
will,
It's all about
yes.
innovating and creating things for our community. Amazing. Maybe a message for people watching.
Yeah. So I would say for those of you watching, especially if you're raising a child with autism and you feel alone, I want you to know that you're not alone. We offer so many classes and so much material, and the material is great. You're going to walk away knowing a lot of things that you don't know now. But the most important thing that you're going to get from us is community. We want to make sure that you walk away from Any Baby Can knowing other parents who are raising kids with autism and not feeling like you're walking this journey alone, because you're not alone. 1 in 36 in San Antonio are raising kids with autism, and our goal is to connect you with those parents so that you never have to walk another step of this by yourself.
Thank you, Tyler.
Absolutely.
And we hope
No,
that
thank
they
you.
can also join us for the 20th annual Walk for Autism.
Yes, I can't believe I didn't mention that. Absolutely.
April 20th at Palo Alto College from 8 a.m. to 11 a.m. And we have that information right there. We want to thank you for joining us this afternoon. If you're looking for more information about that upcoming Any Baby Can Walk for Autism, visit ksatcommunity.com. And if you are in need of support or assistance, here's a list of the organizations we talked about today. Thank you.